Firstly, a very warm welcome to everyone. My name is Adam. I'm currently serving as the Chief of the SmartHealth Leadership Centre over at the National University of Singapore. And today, we're going to talk about leapfrogging the digital health divide. I think this particular session is interesting because whenever we talk about leapfrogging the digital health divide, the number one perception we have is we're going to take some innovations from a so-called advanced country and then move it to a low resource place. Today, we're going to actually flip the lens a little bit. We'll look at some of the innovation that have arisen from low resources settings, innovative solutions that's coming from our guest speakers, and see how we can actually apply them in places like ASEAN and especially Singapore. So I'm not going to hold up the conversation. I'm just going to go straight on and request that our panelists introduce themselves. And I'll start off with Stefan. Stefan, please.
All right, thank you very much. My name is Ogweno from LIFESTEN Health. I'm a co-founder and CEO. And at LIFESTEN Health, we are headquartered in Rwanda, Africa. So the first continent on the core. But also LIFESTEN Health, what we do is we develop incentive-based health and wellness programs that help individuals become healthy. So ideally, we reward individuals for being healthy. But the interesting part about what we do is we also help individuals know their health status without necessarily having to go to health facilities or have wearables by using transdermal optical imaging technology, which is a complex way for saying that with the power of artificial intelligence and the selfie camera on your phone, you can take a 30-second facial scan, which analyzes the blood markers on your face to be able to tell you your blood pressure, blood sugars, and other metabolic health indicators. So we help individuals know their health status, and then we develop programs and approaches for them to be able to improve their health and wellness, and then we reward them for continuously being healthy. So think of us as the person who is out there in the gym in the corner cheering you on as you work, as you walk, as you eat that salad instead of the burger, and then rewards you for continuously being healthy. So that's LIFESTEN.
Thank you. Edward?
Well, hi everybody. Thanks for tuning in. Thanks, Adam, for the invite. And yeah, lovely to be here. I'm Ed, founder and CEO of Reach 52 from the UK, as you can probably hear, but based in Singapore. 52% of the world, or 3.7 billion people, cannot access essential healthcare. So we want to reach the 52%. What we're doing is we're now working in 7 countries, starting in Southeast Asia, but now in India, Kenya, and South Africa as well. We train up health workers and onboard small stores and pharmacies in rural areas to use our tech platform. And then basically health workers collect data on healthcare needs. We then run really targeted precision public health interventions and work on affordable product access through the stores. So sort of decentralized, data-driven primary health in 7 countries, in both Africa, South and Southeast Asia. About 14,500 health workers now, working with about 30 or so corporate partners to fund campaigns and also make affordable, accessible health products available, all in partnership with government. So we work with the government system, with the government health workers, with the government health centers, primary health centers, and look to kind of augment that with products and services that fill the gaps, in partnership with private sector and other funding agencies. But digital divide, huge topic, certainly something we face and work, around every single day. So looking forward to the conversation with you all.
Thank you. Should I invite Jide?
Hey everyone. Thanks for the invite, Adam. It's good to be on this call. So basically, my name is Jide. Short for my name, but my full name is Babajide. Okay, I actually I'm the CEO and founder of Render Health Technology. So I lived in the US, I worked in biotech for a couple of years before moving back to Nigeria to start Render Health. So at Render Health, we are basically a healthcare digital payments company and financing company. And our goal is basically be trying to get data-driven insight from different stakeholders using healthcare payments. So basically, what we're doing at Render Health is understanding the socioeconomic status of each payer, their spending patterns, and also with that data, be able to assist like donors, basically serve as a market access tool for pharmaceutical companies. So basically, one of the things in the African market is, in Nigeria, for example, almost 72, 75% of healthcare payments is out of pocket because of lower health insurance penetration. So what we're trying to do is basically understand the spending pattern of people and the socioeconomic status of each payer by knowing what they can afford, what they cannot afford, and basically provide that data to different stakeholders who want to basically use that data to be able to make valuable decisions for their business. So we're basically using financial transactions to provide data-driven decisions in Nigeria and obviously expand to other African countries. So it's great to be in this conversation. I'm looking to provide more insight in this.
Fantastic. Can I invite Lucy?
Thank you, Adam, so much for the invitation. My name is Lucy Setian. I'm the Director of Digital Transformation at the Novartis Foundation. For those of you who don't know much about the Novartis Foundation, we are a not-for-profit organization based out of Switzerland, working globally with the mandate to improve the health of low-income and under-resourced populations. Now, I do spend a lot of my time working on the African continent, and this is the reason why this topic actually came to be, because I'm extremely passionate about innovation, and so is our whole team within the Novartis Foundation. What we are actually working on is advancing cardiovascular health equity. Cardiovascular population health is a big topic, I would say, for many organizations, and it's not by chance. Every year, around 18 million people around the world die from a cardiovascular event. And the sad part is that 3/4 of these actually happen in low and middle income countries. And the statistics keep on getting worse, actually. So if you think actually of cardiovascular diseases, this is something very complex. Why, you might ask? Because most of the reasons why people actually suffer and die from cardiovascular diseases are so interconnected. So we are actually working to untangle the web of cardiovascular death, causes, if you want, and trying to figure out where is the evidence in what can we do different. And this evidence comes most of the time through three different important pieces. One is the data generating the evidence, the technology enabling potentially not only to collect the data, learn from the data, but also provide useful health tech innovations to tackle some of the challenges around cardiovascular health. But last but not least, the third piece, which I find often also one of the most important, is working on population health with both public and private partners. So this is what we really are working on for the past, I would say, decades, and I'm happy to share more about it in the conversation today.
Fantastic. As the audience can see, we have a very diverse audience coming from all over the world. So let's start. First question, which is, what are some key factors contributing to the digital health divide, especially in underserved or marginalized communities? And I'm going to direct it to Stefan. After you.
All right. Thank you very much for the question. So I'll give, in my response, I'll give context with the Rwandan market and by extension, most of the sub-Saharan market as well, in terms of what are some of the factors contributing to the digital divide. And I think one of the biggest factors that we continue to face is not a lack of internet access, but rather a lack to a strong or much better internet access and connection. So we're talking 3G, 4G, 5G even. We live in ecosystems where the internet is not available, and when it's available, it's not as robust as we might want it to be. So it leads to a significant digital divide whereby only individuals living in certain areas, in certain cities, can be able to access good, strong internet, and then the rest are stuck with 2G or no internet in some cases. And so it becomes very hard to run digital health products which do not take into account the digital connection in terms of internet in the country. And then again, there is the question of access to devices and access and affordability. Are the devices available? Are they affordable? So we are talking here smartphones, we are talking here wearables, we're talking here even computers. But what we see is that there's a lot of effort being made to make these devices accessible. But on the broader scale, comparing the continent against other continents, we see that these devices are still uh, relatively expensive compared to how someone else in more developed nations would be able to access them. So if the devices to be able to access digital products are not available, then clearly you begin to see a divide between the haves and the have-nots. And then maybe I think the other thing would be lack of tailored solutions, like the kind of solutions that are coming on board for digital health divide might not be tailored to the kind of populations that we aim at serving. So, for example, in Africa, we in the past we've seen a lot of innovation from the West, which is aimed at addressing the African markets. And because they are not tailored to the African context, they are not tailored to the solutions on the ground, then they end up creating a divide because people do not end up consuming or benefiting from those technologies, even though they are very well developed. So the question of contextualization of the innovation that uses digital health and technology, I think, is another issue that leads to digital divide as well. So I'll sort of end it at that and pass it back to you or to anyone else on the panel.
Yeah, I guess perhaps I'll just go. Well, firstly, yeah, echo all the points. Predominantly based in Philippines, Indonesia, India, somewhat more digitally mature markets, arguably, but again, very concentrated in cities. And when I go out to the rural areas, the internet often dies pretty quickly, and you get all your emails when you get back to your hotel. So very familiar. But I guess what I was thinking as you were talking is wave a magic wand. I was thinking about my grandma actually. Wave a magic wand, and there's 5G everywhere, and everybody's got a phone. What we often find is if you're not used to consuming digital services, or you're old or above 50, perhaps you're not as mature even if there is a phone, even if there is an internet, you're not a sort of mature health seeker in some of these more rural areas. You're not used to having access to healthcare. So just putting a digital front door on primary health or specialty health, whatever it might be, e-pharmacies, doesn't necessarily solve the problem. So yeah, echo, digital connectivity gaps and so on, but also just health seeker behavior, even if it is available, especially for those that are often most vulnerable and having, significant health issues, such as older people, just are somewhat magnified or amplified as you get more rural as well. I'll pause there as well.
Would Jide or Lucy like to have a go?
Yeah. Yeah. I think that's one of the great points that Stephen mentioned as far as like what is causing a huge digital divide is trying to solve a developing country problem with a developed country solution. And I think I will put myself as one of the first victim of this, because I lived in the U.S. Good part of my life. I went to university in the U.S. Had my primary education here in Nigeria, and I think the first idea is, oh, I've worked in digital health in the U.S. I worked in the pharmaceutical industry. I know about digital health. let me try to bring this developed solution that we have in the US and bring it to Nigeria. And that is actually how Render Health actually started as an electronic medical record. And unfortunately, I got here, and the first year and a half of Render Health was learning the healthcare problems locally and trying to use local problems to solve those solutions. So you have to understand one of the major problems is infrastructure issues. I think in Nigeria here, we don't have 24-hour power. So, which means that everyone has backup generators. Not every hospital or healthcare facility or clinic will have the financial capability to be able to run a generator if, for example, when you don't have power for it's not financially sustainable. So in that kind of situation, you cannot tell a hospital that barely has 24-hour power every day to run a digital solution. They're gonna look at it like, you know what, we're just gonna stick to the old pen and paper. We are saving costs by that. And also digital literacy. I think Edward also touched a little bit about that. A lot of people here, not everyone is technologically savvy. There's situations whereby the nurse who's taking the vitals could be maybe 40 years old, and most likely, while she was receiving education, she never used a computer, probably use a typewriter. So that person is definitely not going to input the vitals in a digital solution. So that's kind of some of the problems that's causing the digital divide, and which it's like digital literacy also tries to user resistance and training. So you don't want to tell a 40-year-old nurse who has been doing her job, for decades, and tell her, okay, now we're going to train you to use a computer and put in blood pressure and put in a possible diagnosis, put in this information. She's going to research. She's like, I don't have time for this. Let me go back to doing things the way we've been doing it, because the problem is getting solved. And yeah, so I think that's kind of some of the problems I'm gonna causing the digital health divide, especially in this market.
Wow. I mean, I'm so happy that actually we brought founders into this call, Adam, because, when we were talking initially, for me, this topic came about from the reality of what we see, right? So for me, two things come to mind. And usually when I talk about leapfrogging, I always talk about these two things because I think they're the most important. Personally, for me, I'm not going to give statistics about things which everybody knows, everyone who works in the health sector knows. What I'm going to talk about is two things. One is the culture of innovation. The culture of innovation on a regional level, if you want, or almost on a continental level. So that's one thing. And the other thing is ability to play the role of a translator. When I talk about the role of translator, I mean it in the ways that the rest of my lovely co-panelists here were talking about, which is about a specific skill set. How do you actually, for example, as an entrepreneur who works in the health and technology sector, how do you have the ability to speak multiple languages to different sets of people and partners? On one side, you have the patients who potentially don't understand half of the technology that you're trying to, ask them to use. On the second side, you have your investors who care about their internal return of their investment. Then you have the policymakers who are trying to potentially come up with new regulations and laws which they have never heard or seen before in a completely different setting than probably in a super mature place, which maybe already has a set of regulations that work. And so as an innovator, you do have kind of like an important task. You have to speak two languages in a way. You have to speak the language of technology on one side, but also the language of the public sector. And for the most part, for the people on this call, this is the public health language. And so I think one thing contributing to the digital divide is the lack of the skills on the ground for people to actually speak fluently these two languages. So that's one thing. And speaking back about culture of innovation, the ability to take risks, but not only purely from the innovator point of view, but also from the government point of view. A culture of innovation is a culture in which you know how to take risks, but you do it in a smart way. You do it in a way that doesn't put a whole country at risk. And I think this is what actually can make the real difference. If we talk about digital divide, how do you bring a true culture of an innovation inside of a government so that the government can actually advance the public health agenda and work with these innovative partners like all the startups and scale-ups which are on this call today? Because this is really truly what actually for me drives the discussion, not so much the things that we already know.
Now, that is very interesting, Lucy. And just from this first question, already I can gather there are so many similarities, even though we're divided by oceans. The challenges that we face are pretty similar. Now, Edward, I know, works a lot in the ASEAN Asia region as well. I do almost the same geographical coverage, Middle East as well. I don't really do a lot of work in Africa. I would love to. So this is really refreshing for me. We face similar challenges regardless whether I'm from Singapore or you're from Nigeria or Rwanda or you're from the Philippines. It's similar challenges. And in a way, that I think is good news because we're not in it alone. And I like the way you rephrased it, Lucy. Innovation is really about culture. It's change management to the patients, to the nurses who are not very familiar with tech. I have several instances where it's so eerily similar. But I guess the next question is, how do we then go on and ensure that we overcome such challenges in terms of implementing digital technologies and solutions, services for these populations? Maybe I'll continue with you, Lucy, on with specific to the topic of culture.
Brilliant. Thank you so much. Well, maybe I'll pick the example from the Health Tech of Africa. So the Health Tech of Africa is a Pan-African accelerator which really brings together on one side startups and scale-ups, and on the other side governments, in order for them to potentially make a change, work on the digital transformation of health systems with the power of public-private partnerships. So I'm going to give an example from there because I think a couple of the things that we're doing there are the things that we probably should be doing more of. And this is in a couple of domains. On one side, you obviously have this ability that I was talking about to speak multiple languages, depending on who are you speaking those languages to and with who do you want to partner actually. So this is really building the local capabilities, the local capacities, and creating the new set of jobs which probably did not exist before. These are jobs which are preparing us for the future, not just for like today's problems, but actually these are the jobs which in 10 years from now will be even more essential potentially than certain things that we see in many of these very nice policy reports. And I'm not going to give quotations, but I think having a health tech as a job and as a profession and a qualification around that is even more important than just having a very traditional job as purely as an engineer or purely as a physician. So this is one thing that we're working on. How do you build the right kind of skills to actually be a health tech innovator, independent of where do you sit inside of a health system? On another side, one important thing I keep on saying is having from the donor side and on the investor side, coordinated mechanisms to support under the right circumstances, or more under the round boundaries, not circumstances, not the right word, under the round boundaries. How do you give support to validate, test, accelerate, and scale some of those innovations? It doesn't matter if you're a private sector investor, if you're a public health sector investor, if you're a foundation such as ourselves. How do you actually create an environment in which you actually fund those innovations under specific boundaries, of course, and how do you do it right? So how do you drive that? So for me, there is a huge importance in actually validating, showcasing the evidence, and I often talk about evidence, that actually these innovations work. And to do that, what we have seen that works the best is by co-creating actually the challenges, the innovation challenges on specific health system topics of relevance for the respective geography together with the local authorities and together with the local communities. So in other words, if you're creating the brief of the challenge, do it with the people who are actually setting the agenda of where the country has to go, but also with the communities which are going to be adopting and using those solutions in the first place. And only then find a coordinated way with donors and funders to fund those things. And I talk often about coordination and the need of increased investments, especially for innovations in low and middle income settings, because it's a huge problem. I mean, currently, if you think of it, there is so much donor funding flowing left and right, completely silos, and people are simply not talking to each other. I don't know why, frankly. So, what we are trying to do at the hub is really try to streamline most of it and create pockets in which people can actually put their funding on, put their resources, be that purely in financial or in kind, but really with a shared goal and do that together, because I think that's the most powerful. And this is one of the solutions that we have seen really work.
Yeah.
That's all right there.
Hey, so I smile when somebody says something I can relate to. And Lucy mentioned a lot of things that she mentioned it. I would just chuckle in the background and just kind of take my notes here. And I just kind of want to touch it. I'm just buttressing what Lucy said. First things I want to touch on is funding. In the African market, health technology is not seen as attractive. It is not an attractive market for investors. Investors would rather invest in fintech. If you look at the statistics, fintech has kind of actually dropped a little bit, but health tech is not an attractive market for investors in this continent. But the interesting thing is there are so much problems in health technology, but the health investors who want to invest in health tech in this market need to be very, very patient. A lot of investors want to just, how can I invest my money in this solution that is going to 10x me it's going to basically triple my investment in the next 1 to 2 years. Health tech in this part of the world, it's a slow grind. We've been in this market since 2018, full time since 2019, and we're still actually developing innovative ways to be able to solve some of these problems. Like I explained, you have to look at these problems through the lens of somebody in the market and not like, oh, this is how it's done in the US. This is how it's done in London. Let us bring that same solution and bring it here. And donors, like you said, like Lucy said, bring that funding to basically pour into a solution that worked in the West and realize that, oh, that fund is going somewhere. That is kind of why at Render Health, we kind of redirected our focus. Like, why don't we basically try to get the analytics, use finances to be able to get data-driven decisions, to be able to show people this is basically what is working and this is what's not working. And another thing is basic working with government. And I think in this market, you need to be creative. You cannot think about this is the way things are done and this is the way it should be done. And that is one of the things the Health Tech Hub is doing. Bringing innovative founders, solving health technology problems with innovative ideas. And one of the things that will make that basically it's very, very important is being able to pair those innovative ideas with government, because a good amount of people who basically are in the health, who go through healthcare problems, go to government hospitals because they're the cheapest, right? Private hospitals, only a few amount of, in Nigeria, if I'm going to speak in Nigeria, I don't know. I've been to Rwanda. I'm not in the healthcare system in Rwanda, so I cannot really speak to that. But most people in Nigeria go to the government hospitals, right? So we need to be able to work directly with government, and the government needs to be more open to be able to kind of bend a little and work with startups to be able to solve some of this problem, instead of saying, this has been working for the past 20 years, this has been working for the past 30 years, let us stick to this. They need to be able to work with startups to be able to develop some of the solutions and look for progress and how we can basically, increase access and quality of health in this market.
Yeah, sort of pick it up from that. I think on the point of public-private partnerships is such an important point when you're talking about innovative solutions at work, because without these partnerships, ideally the startups, especially in the health tech, become face a lot more resistance, even from other future investors and even from the government itself. So the public private partnerships also helps to validate what you're doing, and then even the risk, uh, give a de-risking factor for investors as well. But also the other thing I wanted to talk about in terms of the innovative approaches that work is how do you bridge the tech and the people? As sort of put it, is how do you bridge the online and the offline? And so in this market, there is no way you are going to be develop a solution that's completely and entirely online without having human elements and without having offline capabilities. And here we are talking agents, we are talking nurses, doctors, we are talking community health workers, because these are the people who will get your tech to the people. These are the people who will eventually help you to reach the people. And so there is no way you are going to be innovating in the health space and in this trying to access or solve this digital health divide without actively finding solutions to also bridge the tech and the people. Unlike the West, where the tech might work all on its own, in this side it has to be double-sided. It has to be both tech and people. And so that again is one of the innovative approaches that we found that works in this side of the world, but also I would believe in most of the developing parts of the world as well.
Yeah, and even to some extent, if perhaps we're smiling at the start of Lucy's comments, I'm smiling 3 times, because everything's familiar and everything's kind of the same. I could almost comment across all of that, right? But yeah, Lucy's, I often say about my own job, to Lucy's first point about translation, sometimes we all have to wear suits and shirts and go and speak to big corporations, and sometimes we're softening our language and speaking to government, and then I'm in my Reach 52 t-shirt being a startup guy, and then for the rest of it, you might be out in a rural community, wearing your shorts and sweaty, in some farming communities trying to make tech work. So almost like I think that what you wear sometimes almost showcases the different kind of stakeholders that you work with in this kind of startup world. Financing, just clearly a lack of money. I saw a harrowing statistic. Yes, there's lots of donor money, but we actually added it up. The World Health Organization, World Bank say $172 billion a year is needed for universal health coverage, right? Donors, if you just look at any donor tracking, foreign assistance tracking website, are spending about $35 billion a year. So there's 140 odd billion dollars a year missing that we need. Financing's not enough. Linking to some of the startup world, and the points about fintech being, big focus, certainly agree. Health tech is a long game. It takes persistent, patient capital. It's complex, it's messy. And you know what? Investors like recurring revenue, don't they? But health companies and big donors buy projects and grants and some more projects. And we're all trying to do like output-based as a service models in an incredibly outdated sector who procure things in often outdated ways. And that means investment is harder. So there's all these kind of compounding factors, complex sector with, not enough money probably to begin with, and the way the money's spent to be outdated. So there's all these kind of challenges. But definitely Stephen's comments at the end were almost where my head was at when you asked the question, Adam, of how do we ensure equitable access? It has to be, well, it's like with ChatGPT now, it's never, hopefully, touch wood, it's never going to replace doctors, but doctors that use ChatGPT are going to be better equipped than ones that don't, full stop. It's exactly the same with tech, right? It's not rocket science here. We want to augment and support, not replace. In Reach 52, we work with health workers and small pharmacies in rural areas. They are people and existing places where people go for health support. Worth noting, we did try launching a direct-to-patient or direct-to-community app that did not work. People did not want to use it. They want to go and see a human, full stop. So we do not have a direct-to-patient or direct-to-community B2C kind of app at all now. We have to work through the existing structures that do exist, and by empowering them, 'with tech and data and other tools. Of course, with being paid and basic medicines and everything else they need beyond just the tech. I mean, I think that's the key towards health equity in general, really.
That was fantastic. I was trying to take notes, and I gave up. The good thing is, this conversation is being recorded.
We're recording it.
Clear.
Okay, we're recording it. You can watch it back.
So it's not so bad. But I did say some points. So first thing first, if it helps, fintech is also a big thing over here in Singapore, Asia, and medtech is the not so sexy option. So we do face similar challenges. It gets me sometimes because in my previous careers, I lose staff. They're saying, you know what, I can't make money off health tech. I'm gonna go work in fintech. That was a little bit painful as well, but it's a global problem. I did capture some similarity points. I think there's a need for capacity building, not only for patients. Of course, Lucy mentioned for the healthcare professionals or even a new breed. So maybe they need to generate and train more health informaticians like myself, which is good because that means job creation in a way, although we're not being paid very well, but that's fine. So I think capacity building is something that needs to be done, continued in regions all over the world. In this particular conversation, I think Africa has a need as well. And I do agree, there are contextual differences. There are limitations, challenges that unless you are there in person, you will not understand the type of challenges that is being thrown to you. So earlier on, Jide was having electricity problem. There's a power outage. Now, throw that problem to me when I'm trying to implement something, I will go bonkers because I've never had experience dealing with that. I mean, it's okay to talk about it in theory. Put me in a low resource country and, all the stuff that I've tried before in the Kingdom of Saudi Arabia, in Dubai, in Singapore, in Korea, they will not work in your setting. So definitely something that's contextual. We need to work with people on the ground to understand the possibilities, challenges, clinical workflow differences, accessibility, and so on and so forth. So definitely agree with you. But what I want to do is to put it out there. If you guys are going to look into capacity building in your region, do let me know. I will do it for pro bono. I'm going to move on to the next question. So we talk a little bit about identifying some of the digital divides in our regions. What sort of possibility in terms of ideas on and from drawn of experiences on how we can actually address this. Now, how about taking solutions that has been invented in one setting? No, we talk about developed world solutions being not so applicable in developing world because of the various reasons we talk about. But how do we then build the ecosystem that we talk about, where investors or even potentially universities or NGOs like a foundation can help facilitate the translation of such solutions into the developing countries? Now, I know Edward has done some of this. You work in a lot of countries, and you still are. So maybe I'll throw this question to you.
Yeah, I mean, firstly, I'm going to echo in some comments from earlier. I mean, notwithstanding the fact I'm from UK and I could work a lot in the digitization of the NHS, the National Health Service, and so on, I personally don't think solutions from UK or USA do translate into emerging market settings. We need relatively basic technologies and medicines and other things, but they need to be localized and designed with the user. Very, very simple. Again, we build for offline apps, old versions of Android, supporting about, local dialects. This kind of stuff is important. You don't need lots of fancy stuff in your tech a lot of the time. A basic digital platform is kind of just fit for purpose. I mean, frugal innovation is a phrase I personally like. It's one of our company values as well. But yeah, for me, I guess perhaps you can learn some of the principles, telehealth or electronic medical records or whatever it might be from a health system, whether it be developed or otherwise. But designing locally with your users in mind from the bottom up is the only way that we've sort of been successful in a way. That said, we do have one app and one code base that is used across 7 countries in 12 languages. We've built it to be quite flexible from the outset, though, so the sign-up questions for a resident or a patient can be varied by community. Yeah, language is very easy to customize, and it's quite just a configurable modular app. So I guess just kind of designing with the user, designing for configurability, keeping it basic, considering the digital maturity of markets, so old phones, weak internet, small install files. It's just all really important. But I think, just overall, my frustration actually, not that I want to be a cynical Brit, I'm a happy man. But sometimes I get a bit cynical. But it's frustrating because what we're looking for is we're not asking for super fancy oncology or anything like this, right? It's incredibly basic tech and medicines, and pay the damn health workers that can transform the lives of billions of people and make a material impact on health for all. So for me, it's not so much about innovation or really pushing the boundaries of what's possible kind of thing. It's just like, let's get the basics right, core tech, pay people, and good quality, medicines and health commodities, and you sort of combine them and we can make a material impact, versus the really fancy market leading stuff brought in from America or Europe, which again, it's been touched on earlier, just isn't essential and isn't going to work. We just need to get the basics right from the bottom up, right? Not cynical.
Yeah, yep. I think I'll sort of pick me up from there. Yeah, Serge, you've been leapfrogging over you. Yeah. So
Go ahead, Edward. Go ahead, Stephen.
Yeah. I was just saying that we've been leapfrogging over you on this side of the comment. But anyway, so one of the other things that I sort of like to add to the comments that have already been made is the fact that even in the digital health, we also have to start thinking about curating a new generation. One of the interesting facts about the continent is that whilst we have an ongoing challenge with the older population, we also have very huge potential with the new generation that is more digital health literate, that is more informed, that accesses more of this, that is cooled and can be able to then help us begin to curate a new generation of digital health champions. As has been said, this is, of course, a long-term game. And one of the things I see as part of the innovations that could be used is how do we begin even to also bring in concepts like gamification and behavioral learning into advancing the tech that we're building, and then how do we also begin to use non-traditional methods and approaches to reach non-traditional populations. So when you think of digital health, you primarily would be thinking people like community health workers, people in the field. But how do you reach the young people? How do you reach the working class people? How do you reach how do you use things like TikTok, for example, which have already become very popular all over the world, really? And how do you use various socials to be able to access people? Is some of the ways that we can be able to sort of put together and then contextualize and hopefully be able to continuously bridge this divide. So innovative approaches that are locally driven, that are slightly different, that focus on new markets, that bring components like gamification, behavioral learning, that focus on new generations, I think also should be encouraged, because if the continent's average age is around 25 to 28, then clearly there's a lot of potential there of leveraging on this new technology to be able to sort of leapfrog the innovation as well in the digital health divide. So I'll end it at that and sort of leapfrog Lucy and back to you, Gilles, to sort of, yeah.
Wow. Do you want to say something before me or?
Yeah, yeah, sure. I just have a couple of notes. Edward said something, and it reminded me when I wanted to start Rende Health in 2018. So the first thing I did was we started building we moved back, before I moved back, and we actually held a focus group with a bunch of doctors, and I wanted to understand some of the problems. And so what I did was the first thing I did during the focus group was we actually created an iPhone app, um, and we showed them the iPhone app. And one of the doctor was like, "Oh, so how about Android?" I said, "We don't have one." And was like, "Do you realize this is the Android market?" And first mistake I made. Um, and I was like, "Oh wow." And another thing the doctor said was, "You have to understand, Jide, do you know that you're talking about bringing a to a hospital and into you don't even have syringes. You don't even have like you don't have something in basic necessities. And this is not something we could just like you can't jump from having basic things we need to give patients and then say, hey, here's a computer. But in that, but there's also we have to look at the positives. The positive is that the mobile network is increasing across the African market. Take, for example, in Kenya, M-Pesa. M-Pesa is the digital payment service that has grown really, really fast. Everyone pays with everything in M-Pesa. I mean, I'm not Kenyan, and I know when I was in Kenya sometime last year, and they were like, "Can you M-Pesa me?" I was like, "Oh, I don't know what that is," and I had to break it down from there. Like, wow, this is amazing. We need to take advantage of that growing mobile network in the African market to kind of merge that with health technology to solve some of these problems. And with private-public partnership, a lot of health facilities are doing private-public partnership to like, oh, let's partner with this donor to build this thing. Let's partner with this donor to do this. But there's also some digital healthcare technologies that partners need to be able to work together and say, hey, this is something that has not been done before. Let us try to work with this. If it doesn't work, we learn from it and then we move on. Like you need to break things. If it doesn't work, you move on. Edward mentioned that, they said they tried doing a telehealth session with people and it didn't work. And they moved on from that and they learned. I think that's one of the things that we are doing here at startups trying to, like I said, solve some of these problems locally. And if it doesn't work, we learn from that. And from what we learn, we try to innovate and push things through. And with this idea that we push it through, we need partners in the public space to be able to test those theories and see if that all works.
Wow. I mean, after all of what the guy said, I mean, I don't know where should I chime in, but I think I'll give my perspective from a different angle. I think there is a lot to be learned from the different regions. That's why today's call is kind of the evidence of it. I mean, we're all calling from 3 different continents. And one of the things that I am personally a big fan of is the right kind of settings to meet people, right? To find the right kind of partners. Really, I mean, there's this word that I really don't like, which is convene, but it's truly bringing the people together, really. How do you bring the people together from different regions, even if it's in a virtual space, in like a hybrid option or face to face, just to talk about the things that worked or the things that didn't work? Finding the right kind of value-based partnerships. So that's the obvious one. But one thing that I still think that we're not doing enough in probably most of the continents, and I know both Southeast Asia at least, and Africa to a certain extent, in the health tech space at least, is support for innovative local ecosystems. Think of it like, do you have a regional approach, but you still have these decentralized innovation hubs, decentralized hotspots where people can kind of like tap into the innovation ecosystem? I don't think there is sufficient support. If you think of it, I mean, on the African continent, you have 2, 3 countries which are the leading. Singapore for Southeast Asia is the number one. Maybe there is 1 or 2 more countries which are kind of leading in that space. But there are certain countries where there is absolutely no support for innovative communities. And I think this is what I was talking about when I said the culture of innovation. This should be something boosted not only from the private sector, but also from the public sector. And without those innovation ecosystems, you're not, as a region, you're not going to go too far, let alone as a country. I mean, that's, I think, a number one thing coming to my mind. So I guess my message would be, if you want to find a good partner, sometimes maybe they're sitting in the wrong continents, but you can find them and potentially learn from them. And then just to finish the story about one thing that we're working on, I mean, in innovation spaces, you often talk about learning from failure, so failing forward. But I think this is something that political parties in governments don't like talking about, because obviously it doesn't look very good if you're a politician and if you're talking about your own failures, right? So how can we have a fail forward culture within governments in which they're openly talking about the things that maybe didn't work very well in their digitalization process? What are the decisions that they potentially took or didn't take also, which didn't actually advance the national agenda of health system transformation? So how can we maybe push the needle a little bit more on bringing this innovation skill set inside of the policymakers' mindset and actual technical skill set? Because I think this is the most impactful. These are the people leading the countries in the end of the day. So if they have the same skill set as these guys on the call today, maybe the situation is going to be much more positive, I would say, and the results are going to be faster potentially. So one thing we're working on right now is for the Health Tech of Africa, we are supporting actually with funding and in-kind support a number of use cases for acceleration, scale-up, and fast-tracking use cases, we call them, which are like public-private partnerships projects. Some of them are smaller, some of them are bigger. But we want to capture what are these policy and regulation gaps and learnings which came from these use cases. And I think, Steve, you can speak a lot about that. And we want to bring this forward directly to the different ministries, both of innovation, ICT, ministries of health, implementing agencies, and et cetera, to have this very tangible, concrete set of recommendations of what did we see working well in the regulatory policy space when you talk about public-private partnership type of projects. And what did we see? It's clearly a gap, something that's either not there. So maybe there is a whole process that's not there, or there is a whole policy that simply doesn't exist, or it's something that they didn't know about the gap. You know, there are the different options in the story. So we are capturing all of this from the real world projects that the hub is supporting through the partnership and the coalition of all these great organizations making it happen. And we want to socialize this on a Pan-African level with the heads of states. So it goes a bit higher to the agenda. So this is something that I think is truly important to really show or transform the noise into signal and say, okay, these are maybe the top 5 things that we should be doing. And it's coming from the real world because there is the evidence. These are the projects. There is the funded projects. There is the collaboration we signed. But these are the things that didn't work. And these are the things that worked. So how can we do more of that?
You know, that's interesting. Gathering from the conversation, definitely core hard skills, technical skills are important to facilitate conversations, especially to key stakeholders, people in position of power who may or may not know what they're doing. Well, chances are most of the time they don't, but yeah. But there are some other soft skills which are pretty important as well. I can see that, you know, having an agile mindset, you know, is very important in this journey of building an ecosystem where failure is actually embraced and moving on. You know, take from lessons learned as opposed to trying to find out, you know, what went wrong and then pinpoint errors. So I think that's important. I didn't hear the key word, but I can infer from the conversation there was a bit of design thinking methodologies used from different stakeholders. So I think that's something that we should encourage stakeholders in various settings. So these are great soft skills. In my opinion, that's easier to build a culture around in places in Africa, in ASEAN, in Singapore. In fact, we are trying to build up those capabilities as well, in addition to the technical aspects. But all in all, this is great stuff. Now, I'm mindful of the time. So what I'm going to do is to ask each of you to give some parting wisdom to the audience. And I'm going to start off with you, Lucy, because you just entered the last bit.
Oh, you're making it hard for me. Parting wisdom. I think we should be having more of these conversations and slightly more often than probably once a year. So maybe one parting wisdom would be think if you're working in a specific market, can you maybe look in the other continent of an organization doing something quite similar as you, but in a different way, and try to find synergies with these guys? Because sometimes you might think of organizations as competitors, but actually they are partners. So maybe think about that. That's my kind of parting takeaway. And of course, think of partnerships also with public authorities, if you haven't done that already. Over to Gide, maybe?
Yeah. Yeah. Party. I think I think everything I'm gonna say, it's kind of like a summary of everything that's being said. I think one of the major thing is in this market, we need financial support to grow innovative ideas. Because most of what we need to do is not like just touching back on like something that you said with donor funding. I think Edward mentioned that there's a lot of donor funding, but those funds are not being matched to the appropriate resources to the people who need it. And like I think a bunch of these donors, they're like, you know what, we've been working with this partner for a while. Let's keep working with them. But a lot of those funding needs to be redirected to startups who are basically trying to looking for innovative ideas to solve these problems. And I think one of the things we need to be able to do is basically try to work with local people to be able to solve some of these solutions. And I think that is in the long term. Like I said, I think if you're in health tech, you're in it for the long term. You're not looking to like quit after like 2-3 years, because it's a long term play. And I think that we need to basically work with startups who are basically working every day on ground, boots on the ground to solve some of this problem. And I think that would definitely increase improve healthcare and quality of health in this market.
All right, so I'll sort of take it from there. I think in terms of parting wisdom, we need to contextualize the innovation. We need to synergize with various governments and private partners. And I think we need to continuously expand or seek for multi-country collaborations or multi-regional collaborations as well, because as we had on the call, we all have same challenges. We might as well share the solutions across the divide.
Yeah, I was supposed to make one of the points. I wanted to just comment on something after Lucy spoke, and then I'll give a very short parting wisdom if I have such a thing. But yeah, just on that role of government, I just read a fascinating book. I really recommend it. Role of government. I do believe strong political will, is the key towards health for all. I think a lot of us would agree with that. There's just a book called The Entrepreneurial State. I'd really recommend it. It's like basically the internet is a government invention, touchscreen is a government invention. Most billion-dollar pharma interventions were funded by government for academic research, etc. But nowadays in the modern world, the government's not allowed to fail. VCs, portfolio theory, bet on 12, 15 companies. They expect 1 or 2 winners. But a lot of modern day innovation has come from government in the sort of 70s, 80s, 90s, but now they're not given as much freedom to fail. Private investors are, they're seen as innovative. So I just completely agree with Lucy. And I think it's really important to, change the way that we view government, and they should be allowed to innovate in the same way as private sector, and failure should be tolerable. But sort of like modern democracy and perceptions of use of, taxpayer money and stuff doesn't allow that. But yeah, really recommend The Entrepreneurial State as a book on that topic, which favorite thing I've read recently on exactly this. But yeah, parting wisdom, I wrote down. Good things take time, and as Barack Obama says, hard things are hard. So parting website is triple your estimates for everything and commit for the long term. Triple the amount of money you need, triple the amount of time you need, and then settle in, because it's going to be hard. And if you want to do it, then do it. But triple your estimates and commit.
That's
Thanks.
very good advice. In fact, I'll take some of those advice myself when I do budgeting. Well, I believe the audience have benefited from this conversation. I definitely have. And we've definitely covered a lot of common ground and explore some potential interventions, if you will, if I would use a technical term for that, for such scenarios and issues. And what I do suggest is echoing what Lucy has mentioned. This shouldn't be a one-off annual conversation. We should have such conversations on a regular basis. I definitely benefited from the different lenses that each of the panelists have brought. So yeah, let's carry these lessons forward. Let's continue having the conversation. I would like to thank each and every one of you for your time. Sincerely appreciate it. And until the next time, goodbye.
Bye.
And before we forget, I'd like to invite all of you to scan the QR code and provide your feedback with regards to this session.